UnitedHealthcare. She's here to discuss how you can make the most of your Medicare coverage in 2019, and also to talk about a really important date that is coming up here. And we are just days away from, what do we call it?
Part D Day.
Part D Day. And I think a lot of people caught on last time we talked about that, because that's how people are remembering when the deadline is. Now explain what the deadline is.
That's right. So everyone has until Saturday, December 7th, to enroll in their Medicare plans for next year, for 2020. So it's very important that everyone, take the last few days and make those decisions carefully and thoughtfully, because it's really important to make sure that your doctors and your prescription drugs are covered.
How many people does this affect here in the United States every year?
So over 60 million.
Over 60 million people. And this is something you have to do every single year, right?
Yes, and it's a growing number too, with all of the baby boomers getting into that retirement age.
So why doesn't somebody just say, you know what, I had this plan going last year, it was just fine, I'm just going to leave it alone? What's the thought process there? Why would you say, no, you need to look at it?
Well, because things change from year to year. So doctors may come and go from different plan coverages, and your prescription coverages may change as well. So it's always important just to review and take a look, as well as just to make sure that you have the right coverage for you. Because a lot of people for years had the traditional Medicare, which is Part A and B, but Medicare Advantage is something that was newer on the scene, over the last decade, and over the last 5 years it has grown just exponentially. And Medicare Advantage, which combines Part A and B, is unique because it also incorporates Part D for D-Day, as well as additional benefits that we've talked about before.
Now let's talk about this Medicare Advantage. We've mentioned it a couple of times when you paid us a visit. Is there an extra charge for Medicare Advantage, or is it a matter of just signing up to make sure you're part of it?
There's no extra charge.
See, that's I'm glad, and I want you to stress that. There is no extra charge. It's just a matter of getting in the program, right?
Yes.
See that?
Yep. So the Medicare Advantage is great, especially for those that are budget conscious, which most people are when they're retiring and they're on a fixed income, because it incorporates those prescription drugs. It's really taking a look to make sure that everything is going to be covered. You know what you're paying, you know what's covered, and then you can take advantage of those extra benefits, and all of that is, within one plan.
Yeah, and it's really surprising. To be honest with you, in our conversations, I'm really shocked that it isn't an automatic enrollment in the Advantage plan, because there's so many benefits to it. But you mentioned the prescriptions, and for those people that are getting older, that's a huge part of your budget.
It is. And let's talk a minute just about having people trying to stay healthy, and some of the things that these these plans cover.
Sure. So we've talked a little bit about the gym benefits, which, to me is huge, not just from a physical perspective, but also a social, perspective, because you're getting out of the house, and even that mental, healthy mental state.
Because it's easy for someone to get locked in and not go anywhere.
Right. And it's easy just to, do your same routine, but making some changes to keep healthy and keep active is so important, especially, as you get towards that retirement age, making sure you are staying physical and getting out of the house. The second thing that we can mention here is we have the 24-hour, 7 days a week nurse line.
Okay, so what is that?
So people can call in, ask questions to a nurse. So a nurse could then triage if you need to go to your provider, go see your doctor, go to the ER, or if you just have a question about, maybe you have a headache, or maybe you have a rash.
So if you're not feeling well, you can pick up the phone or get a hold of somebody 24 hours a day, and there's somebody that's available.
Yep. And it's just a great opportunity to talk to a professional who can give you some seasoned advice.
Right, how about that? Now I'm going to go back, I'm going to downshift a little bit and go back to the prescription drugs, because we've seen the costs of prescription drugs skyrocket in the past decade or so, and they're still going up.
Right.
But there is some tricks that you can do, and some things you can do, and Medicare Advantage gives you the ability to take advantage of some of these plans, right?
Sure. So one of my favorite options or highlights of this plan is, for our members, we have the option to do a 3-day mail order for your benefits, for your prescription drugs. So you can sign up and get your drugs for the next 90 days sent directly to your home, and the financial savings comes in where you only pay that one-time copay or whatever your charges. So if you have to pay $3, you only pay it one time for 90 days, rather than going to Walgreens or your local Hy-Vee pharmacy and paying that $3 every month.
Every time you fill it.
So you're getting that essentially 3 for
little bit of
1.
a
So you get
savings
3 months at a time. So and again, you don't have to make a run physically
Right.
to the store to pick things up or to the
Right.
pharmacy to pick them up. They bring them all right to you.
Right, and that's great to make sure that people, remember to get their prescriptions filled, because that's something that sometimes people forget to go get them filled, and then if you don't have it, you don't take it, and it becomes a bad habit. So this is an easy way to make sure that you are staying healthy, you're staying on top of things, and you're doing what you can even from your own home.
Right, and I think that's just it. Some of these benefits are really spelled out in the Advantage plan, and you have some people there that be able to walk you through some of these things too, right?
Yes, correct. So if you have questions, there's always people that are able to take your calls, or even online where you can read different frequently asked questions. It's very, very simple to find.
because it can be a little overwhelming for people to have to do that on their own. So having that service. You have a great story to share, kind of just with talking about the Medicare Advantage and one of your members.
Sure. So another one of the benefits to the Medicare Advantage plans is a benefit called house calls. So that's one of my favorites.
I haven't heard of this.
So house calls is similar to the nurse line, except it's where a healthcare professional, usually it's a physician's assistant, will come into your home, or a nurse practitioner.
Seriously?
And they will do a physical.
No way.
So it's fantastic for people that don't have transportation, that live in our winters, as we were just discussing, our horrible 6-month winters, or, just don't want to leave their house, or physically.
Or maybe have a hard time. You have a hard time getting around. Maybe they can get around their home okay, but getting outside might be a task.
Yes. So they can call and request an at-home physical. It's called a house call.
Okay.
Or someone will call and offer that one to them when they're signing up for their plan and enrolling. But it's fantastic because that professional will come in and assess you. And so one of our members who signed up for Medicare Advantage went ahead and took advantage of this program, and she came in and noticed that there was some challenges he was having with his medication and his heart rate. And so she said, you need to go to see your PCP, your primary care physician.
Okay.
And so he did, and they went ahead and adjusted his medications. And a year later, when she followed back up with him at the next house call, he told her, "You saved my life." And so he goes, "I'm just so thankful, because I wouldn't have known to go to my doctor to get that checked out and make sure I was staying on the right medication."
Because there's probably no way in the world he ever would have went to the doctor to check this out, because he probably didn't realize what was going on.
Right.
And that's a testament to making sure people get the right plan, they're getting the coverage and the treatments that they need right away, and you're making sure that that they have what they need when they need it.
Okay.
It's so important, the right care at the right time.
All right, so again, if you have not, re-upped on your plan, you have until Saturday, that is December the 7th, that is Plan D Day, is what we dubbed it here last
4
time
days.
that you were here. You have 4 days to do this, and don't just let it ride. If they have some questions about this, saying, okay, how is this plan better, the Advantage plan better, and as you mentioned, it's no additional cost. You just have to sign up for it. You have to get involved in the program, right?
Yep, so I would encourage anyone to make sure that they're going, again, to the website, to making sure that they have the right coverage for their needs. You can go to MedicareMadeClear.com, or you can also go to UnitedHealthcare's website, UHC.com, and you can look for Medicare information. But it's just really important to make sure that you're taking the time. This is no different than making any other financial decision, making sure you're looking through everything. Again, doctors and prescriptions can change annually, so make sure they're still within your network.
That's awesome. And so you take advantage of this, but you only have until Saturday.
Take
You guys
advantage.
do a great job of making sure everybody's getting the information that they need and trying to make sure everybody has what they need.
Well, that's our goal.
That is awesome. Thank you so much for being here.
You're welcome.
Great to see you again.
Thank you.
It is 10 minutes.